All right. Hi, everyone. Thanks for joining us here on Twitter Spaces, our podcast, and other platforms for our discussion on the COVID-19 vaccine for children ages 5 through 11. I'm Melissa Dudon, a producer with the City of Las Vegas. Now, when it comes to the COVID-19 vaccine, experts say it's safe, effective, and free, but it's also a hot button issue because some folks are not on board. And when you mention the vaccine and kids, well, that creates even more of a mixed bag of reactions and emotions, as you can imagine. Today, experts join us to talk about everything you need to know about the FDA and CDC-approved Pfizer vaccine for kids ages 5 to 11. So we're so happy you all are joining us. All right, so let's get started. Starting today, a pediatric COVID-19 vaccine will be available for children 5 to 11 at the Southern Nevada Health District locations. The Center for Disease Control and Prevention recommended that this age group be vaccinated against COVID-19 with the Pfizer pediatric vaccine. Now, that's a total of 28 million children in the United States in this age group who are now available to receive the COVID-19 vaccination. In Clark County, that's approximately 209,000 children between the ages of 5 and 11 that are eligible. A total of 37,006 cases of COVID-19 in Clark County have been reported in children between the ages of 5 to 17. Now, as we all know, children may be at lower risk than adults of becoming seriously ill, but it is still possible. There have been 266 hospitalizations of children ages 5 to 17 and 4 deaths in this age group. So now I'd like to introduce everyone to our speakers. Joining us today, we have JoAnn Rupiper, Chief Administrative Nurse at the Southern Nevada Health District. We have Dirks Garcia, President of the Nevada PTA. And we also have Pediatrician Dr. Tal Minuskin with the Clark County Medical Society. Thank you all so much for joining us today.
Oh, glad to be on board with you.
Thank you for having me.
Hello, thank you.
All right, so we're going to go ahead and start with the pros and cons. JoAnn, I want to direct this question to you with the Health District. What are the pros and cons of getting your children vaccinated with the COVID-19 vaccine? It seems like such a easy question, but there's still so many questions behind the vaccine. So if you can answer that for us.
If you get your child vaccinated with the COVID-19 vaccine, that means that reduces the risk of your child getting the vaccine and also then spreading it through the community as well. So and for cons, not too much. I mean, it is an injection, so it does. There is, you have to work with your child and talk to them and coach them through that procedure. But another pro too is that some children have experienced a lot of anxiety being out in the world with COVID. They are fearful of getting sick. So this might be actually reassuring for some children as they return back to school.
Yeah, JoAnn, that's actually a really good point. I have a 7-year-old who has expressed to me some concern and anxiety over being out in public without a face mask. I think he is a little nervous of what COVID means here in the community. So let's go ahead and explain the dose regimen for kids 5 to 11. Dr. Minuskin, I'd like to throw this question to you. How many doses will children get? Is the dosage the same? I believe it's a lower dose, correct?
Yes, that is absolutely correct. The dose is 1/3 of the adult dose, 10 micrograms. They're also going to need a booster 21 days apart, just like the adult dose. What is interesting is if they actually turn 12 between the doses, their second dose would actually be the higher dose, the adult of 30 micrograms.
Oh, that's very interesting. I didn't know that. Okay. So I guess, Rebecca, let's bring you into the conversation from the Nevada PTA. What are some of the concerns that parents you've spoken with have? I'm sure you've heard a lot of questions coming into the Nevada PTA.
There have been a lot of questions related to the vaccines. I think, for most parents, the vaccines we're used to for our kids have been around sometimes for decades. And so a lot of parents are concerned about how long this has been studied. Was it pushed through too quickly? And then also because children have had COVID often less severe than adults, sometimes parents are saying, well, why do they even need it if it's not as likely to be as severe for my kid especially if they feel like they don't know what the impact will be 10 or 20 years from now. I think that's one of those other things. Not only is it new, the question is, will this impact my child when they're 30 or 40 years old?
Right. Have you had any other specific questions from parents, though, about, if schools are going to require this, if they're not, do they have to? Is it mandatory? Have you received those kinds of questions as well?
Yes, the potential related to legal mandates for the vaccine is a huge question. Parents want to know if it will be mandated, who gets to make that decision, and what would be the timeline for that. Because obviously there's some parents who do not want to see their children vaccinated. So then there's also questions related to, if a mandate does come into play, will there be similar exemptions to what we see right now for medical or religious reasons?
Right. And there are just so many questions still surrounding, I think, how this rollout goes and where we go from here. But let's talk about the vaccine and going to some rare adverse events, such as we have all heard in the media, myocarditis, which is inflammation of the heart that's been observed in young adults and young men. It's been a concern for parents that have been thinking about getting their children vaccinated. JoAnn, what can you tell us about this condition? Is there concern? Should parents be concerned about this? And then Dr. Minuskin, I'd like to hear from you after JoAnn.
Sure. So with the side effects, like you said, mostly in the young adult age range. The doctor can certainly speak to what has been going on with this vaccine, but they're rare at this point in this age range, and the benefits certainly would outweigh the risk of the vaccine.
Yeah, I'll piggyback off of that. The study that was done had about 4,600 children between the ages of 5 to 11. Not one of them had a complication of myocarditis. They had the usual side effects of fever, body aches, localized redness at the vaccine site. We presume there may be some that will end up getting myocarditis at some point, but so far we haven't seen anybody from the vaccine. This was studied in the United Kingdom as well as the United States. I want to just add, the cases of myocarditis that happened because of the vaccine in the young adults were minor, resolved on their own, and they did not need any treatment.
And doctor, what would you say with children getting a mild form of COVID? There are instances where it does become more severe illness.
Well, unfortunately, the illness itself, COVID, causes myocarditis, which can be much more severe than any vaccine-related side effect. There have been cases of multi-inflammatory syndrome, about 2,300 cases in this age group in the United States, and that has myocarditis involved with other organs as well. It can be very severe. Some of the children need to go to the ICU. This is not vaccine-related. This is illness-related, COVID illness-related.
Okay, that's really good to know. So you kind of touched on it, doctor, a little bit. Can you tell us how some of the children in trial studies, and JoAnn, you may be able to answer this as well, how have they reacted to the vaccine? Were there a lot of side effects? What should parents expect? We've heard different things from people about the adult dosage with the booster shots, that maybe the effects were a little bit more strong than they anticipated, or just a little worse than the second time around, but still manageable. What can we expect for the kids?
I don't have that answer. It's a very good question. I think we'll find this out as we go along. According to what Pfizer published and submitted to the FDA, there were minimal side effects in the majority of the patients and no severe complications. But we continue to monitor, and everybody is aware of the FAERS, the Vaccine Adverse Effects Reporting System. A parent, a patient, a physician, anybody can report any side effects, and this is going to continue to be monitored for all the age groups and for all the vaccines administered.
Right, and I'll say that we kind of talked about it. The side effects are similar to what most adults experience, which is what the doctor had talked about, is soreness in the arm, possibly fever.
Well, let me just add something. The reason they gave 1/3 the dose, they found that it was equally as effective as the adult dose and less side effects, which is why they are administering a 10 microgram dose to the 5 to 11-year-old age group.
Okay, interesting. So, doctor, if you could tell us, what are some of the most common questions you're actually getting as a pediatrician from parents regarding the vaccine?
I understand parents' trepidation and fear of the unknown and the future. I'm a parent myself. I have 2 children in that age group. I have 3 in the older age group that got their vaccine as soon as it was available for their 12 to 16. I'm all for it. I see these diseases, they can be much more severe than any unknown in the future. Everybody, I'm sure, has been touched by a friend or relative that has succumbed to this disease. It's much more intensive than anybody could have expected. I thought it was going to be a mild flu when it first came out, and I underestimated it completely. I have children that are going to school. I want them as protected as possible. And I can't fear the unknown. I don't believe in any conspiracy theory. There are parents in the CDC and the FDA at Pfizer, and I can't believe that all these parents are going to hide something that is available to the public.
Yeah, I think that's really interesting because, we live in a world, especially with social media, where people get their information from different sources. There's a lot of confusion as to what to believe. So I think it's really important to talk to your pediatricians, talk to the health district, get your information from your credible sources that have the science to back this up. But I obviously still a lot of concern, and we don't want to diminish those concerns at all, because they're still serious concerns from parents out there. So Rebecca, let me go to you. What proactive steps do you see parents taking to inform themselves, ease their fears or concerns about the vaccine? This is also obviously a personal decision for every family out there.
Well, I think one of the absolute most important things is to speak with actual medical professionals like we have on this panel today. I'm a parent of 4. I have a child in this age range as well as in the 12 and up. And so being able to speak to my pediatrician who knew my children and who knew my children's health was really important to me. I know a lot of parents are doing research as well. I think always the challenge, though, is there's so much information on the internet. Sometimes it's hard to figure out what is correct or not. So taking it back to valid sources, I think, is really important. And again, making sure you're talking to your child's medical professional so that you're getting the most informed, opinion, because they know your child and they know the science.
Well, JoAnn, let me ask you a question. What would you say to the people that say, well, why even vaccinate this age group? Because kids 5 to 11, they don't get COVID. And if they do well with it, or they're asymptomatic, or it's a very mild case. What do you say to that group of people?
Well, I think that one of the issues is that it's a school-age child. So some children may be contagious before they get sick. So you're protecting your child from getting the COVID disease by vaccinating that child. And especially if your child has some type of chronic condition, such as asthma, that you want them to be protected as well, so they don't get COVID and then also get sick with other conditions. One of the other thoughts was it's similar to when we had pertussis a few years ago, where those under 5 are not protected, and you may want to, what we would say, cocoon those children, or those who may not respond well to the vaccine, such as those who are immunocompromised, like those with cancer, grandmothers, grandfathers. So what you're saying is that you are vaccinating that child so that they don't spread it to those who are vulnerable, which are can be the children under 5, and then your extended family that are older or may have medical conditions. I know for myself, I would feel terrible if I spread that to someone else. I don't know if anyone else has those fears, and you don't want your child either to be in that situation. So I think it's important to get those kids vaccinated. And it kind of gives you, I don't know about those who are vaccinated, but it gives you a sense of freedom where you don't have to worry as much. You still want them to mask right now indoors and such, but it does give you a little bit of less anxiety.
Absolutely. JoAnn, let me just ask you, because we are kind of going into the travel season, the holiday season, how long for once a child is vaccinated and then they wait the 21 days and get their second dose, how long before that vaccine becomes fully effective in their bodies?
Well, typically for any vaccine, it's 1 to 2 weeks after. So, I would just go ahead. If it's 2 days before, just do it 2 days before and get the vaccine. It'll still give you some protection as time wears on. But just about 1 to 2 weeks, I would say.
Okay, and doctor, let me ask you, what are you telling people, your patients, the parents of your patients, I should say, when they say, well, kids aren't getting it, they're getting milder cases of COVID, I just don't see the need. What are you telling them?
Well, now that we've had the Delta variant, it's not the same. They had been more asymptomatic and milder cases. That's not the case anymore. The number of patients between 5 to 11 had just mushroomed ever since the school year started in August, and they were getting just as sick as the older population. It's obviously a parent's choice. We can't make any decision for the parent. They want to do what's best for their child, and I understand that as a fellow parent. The Pfizer vaccine for 5 to 11 was found to be 90.7, so basically 91% effective at preventing disease, including the Delta variant in this age group. That means, unfortunately, some kids still get it, but the majority of cases that are immunized, like the flu, we're preventing serious complications. So if they will get sick with the vaccine on board, typically they'll have a milder illness or not get sick at all. As opposed to the ones that are unimmunized or underimmunized, they can get a severe illness like that multi-inflammatory syndrome or being in the ICU and having a very significant respiratory compromise. Regardless of underlying condition, obviously the ones with underlying medical conditions can get it even worse.
Absolutely. Well, it's a very scary topic, a scary time, but thankfully there is a vaccine available for those who want to protect themselves, protect their kids, protect their community. Before we go, I wanted to open it up to our speakers. Is there anything I missed that you'd like to touch on quickly?
Well, I guess, Melissa, I have a question for parents. Is it available only through the health district and pediatricians right now, or how do we find out where to get the vaccine potentially for our child, especially if you don't have a current pediatrician?
It's my understanding a lot of the pharmacies do have the vaccine as well. You could go to covidfighter.org to find a clinic for the Pfizer vaccine particularly. And my understanding is they do have a way to find out if there's vaccine for kids on that site. And then you could look at our website too. We have lots of different clinics. We are in schools. We're at the CSN locations. We're at Galleria Mall. And then I think a lot of the physicians do have the vaccine, but, you can also access there.
Great. Thank you.
I'm working on getting it. I don't think a lot of the physicians have. We have some practices that have already started getting supply. It's a little more complicated, a lot of red tape and bureaucracy to get the vaccine in our offices. I'm working on it. My children are scheduled to get at Walgreens. So Walgreens, CVS, Save-On, Smith's, obviously now the health department, they're having access and a lot of appointments. I know that when I logged in, there were quite a few appointments. So I would recommend trying out any of the aforementioned websites, and you can schedule for your children easily.
And for the health district right now, we're moving our platform on with for children, so you can actually just walk in.
Okay, so you can walk in, JoAnn, is what you're saying. You don't have to make an appointment. Will
Correct.
appointments be available at a later time once your computer software or anything, programs need to be switched around to accommodate the 5 to 11-year-olds, or will it solely be on a walk-in basis from here on out?
It's just temporarily walk-in. We'll have it ready probably late next week. And then, but we still allow walk-ins anyway, even if you don't have an appointment, we'll take either.
Okay, and I can definitely confirm that CVS does have it. I'm taking my 7-year-old tonight to get his COVID vaccine, so you can wish us well for that. Hopefully there will be a big brave face for him going forward. But I want to thank you guys all for joining us today. This wraps up our discussion about the COVID-19 vaccine and children. So for more information on the vaccine, you can always go to our website, lasvegasnevada.gov/coronavirus, or you can check out the Southern Nevada Health District at snhd.info/COVID. Thank you all so much for joining us.
Thank you.
Thanks so much, Melissa.
Thank you for the opportunity to speak.
You guys have a great afternoon.